arises from L4, L5, S1, S2, S3. The united fibres form a large nerve trunk, the sciatic nerve, which enters the limb below piriformis through the lower part of the greater sciatic terrain. It lies beneath the cover of gluteus maximus at this point. The nerve then descends centrally through the gluteal region, crossing each of these small lateral rotators in turn. So it crosses gemellus superior, the tendon of obturator internus, gemellus inferior, the tendon of obturator externus, quadratus femoris. It leaves the gluteal region by lying beneath or deep to the hamstrings and lying between the short head of biceps and the hamstring part of adductor magnus. At a junction roughly between the upper 2/3 and lower 1/3 of the thigh, it divides into its two terminal branches. A tibial nerve, which descends centrally down the back of the thigh, bisecting the upper and lower quadrants of the popliteal fossa, and a common perineal nerve, which passes laterally and passes towards the head and neck of the fibula. The tibial branch of the sciatic nerve supplies all the hamstring muscles, with the exception of the short head of biceps. The short head of biceps, you can see, is in close contact with the common perineal nerve. So the common perineal nerve supplies the short head of biceps, the tibial portion, the remaining hamstrings. The remaining hamstrings being semitendinosus, semimembranosus on the medial aspect, and the hamstring portion of the adductor magnus. On the lateral side, the long head of biceps, common perineal nerve, the short head of biceps. The common perineal nerve winds around the neck of the fibula before entering into the mass of perineus longus muscle. Deep within perineus longus, the common perineal nerve divides into its two terminal branches, the deep and the superficial perineal nerve. The superficial perineal nerve emerges onto the front of the leg, onto the anterolateral aspect of the leg, and offers cutaneous supply to the lower 2/3 of the lateral, anterolateral aspect of the leg, and the majority of the dorsum of the foot. The deep perineal nerve, there is the superficial, making its way towards the surface. The deep perineal nerve, you can see, descends on the anterior border of the interosseous membrane, and it descends with the anterior tibial artery all the way down the front of the leg. The deep perineal nerve supplies all the anterior compartment muscles. The superficial perineal nerve supplies the two perineal muscles in the lateral compartment of the leg. The deep perineal nerve enters the foot along with the anterior tibial artery and passes onto the dorsum of the foot. It supplies all the intrinsic muscles of the dorsum: extensor digitorum brevis, extensor hallucis brevis, and that first dorsal interosseous muscle. It supplies all the tarsal joints. So it has numerous articular branches to the tarsal joints. The deep perineal nerve terminates at the base of the first and second toes at that first toe cleft, and cutaneous branches pass up the adjacent sides of the first and second toe. So this deep perineal nerve at its depth then is supplying the lateral side of the big toe and the medial side of the second toe. So here, this forking, this bifurcation of the nerve is a cutaneous branch. So essentially, the deep perineal nerve is a muscular and articular nerve with just a small cutaneous branch supplying that first toe cleft. By way of recap, we can say that the superficial perineal nerve is essentially a cutaneous nerve, and it supplies the two perineal muscles as it burrows its way to the surface. Can you burrow your way to the surface? I don't know. We talk about burrowing down, don't we? Digging its way out. So it is superficial perineal nerve then is innervating an increasing wedge of skin that accounts for pretty well all the dorsal aspects of the foot, with the exception of the medial border as far as the base of the first toe, and the lateral border, which is supplied by the sural. The tibial nerve, meantime, traverses the popliteal fossa. The medial genicular nerves, superior and inferior, and the middle genicular nerve arise from the medial aspect of the tibial nerve. The lateral superior and inferior genicular nerves are from the common perineum. The chief branch of the tibial nerve in the popliteal fossa is the sural nerve, which is this cutaneous